This meeting is being recorded.
Okay, go ahead. Started now? Yes.
Well, good evening, everyone, and welcome back to Ask the Doctor. And this is a series that has been put together by Latino Health Access. And today we're also joined by Santa Ana College. And we hope students from Santa Ana College will be joining us. You're very welcome. We have a great session today. We have Dr. Salvador Hernandez from Kaiser Permanente with us. We're just going to allow a couple of minutes as people are joining us, again, to welcome you. This is a space that has been created for our community to have a chat, to have a conversation about the most important topics on COVID. And every week it has been a different angle, a different topic. And we will have plenty of time for questions from the audience. At the beginning, we'll just start with a few reflections and a few questions that we've prepared for Dr. Hernandez. And let me again introduce Dr. Hernandez. He is an infectious disease director at Kaiser Permanente of Orange County. So today's session is specifically dedicated to thinking about these 2 years of the pandemic. And I want us all to think back. March 11, 2020. And some of you remember what you were doing when you watched the news. You may not remember. For many of us that work in public health, that was a very important day. That was the day that the World Health Organization announced officially that we were living a pandemic. And I remember March 11, 2020. I also remember that before that, so during the month of February, the month of January 2020, and the month of December, I had been, so like most of us, watching the news and seeing what was happening in other countries. And in my personal experience, even as a doctor in public health, was thinking, wow, that this disease that they're talking about and closing entire cities far away in China, that seems so far away, and something that even in my own mindset was difficult to think that we were going to go through a similar experience. I could not really imagine that an entire city would be locked down, that the places of gathering would be closed down. So many different experiences were just developing in front of our eyes. So forward 2 years, being the second anniversary. And okay, I'm back. Little tech issue. And so today, here we are to talk about what is going on as of now in the stage that we're at in the pandemic. And that's how I'd like to start with Dr. Hernandez. First, if you'd like to invite you to introduce yourself, and then, tell us about what these 2 years have been for you as an infectious disease specialist, and what are some of the main points of reflection, of takeaways, of messages for us regarding these 2 years of the pandemic. Over to you, Dr. Hernandez.
Okay, thank you. Thank you, Dr. Giraldo, and good evening or afternoon to all of you guys. And thank you for inviting me to be in this forum. It's a pleasure. So yeah, what 2 years it has been. I never imagined that in my life I will live a pandemic, like this.
Hasta
You
que
know,
no toque fondo ese.
we do read about pandemics in our training, but never think that you're going to live a pandemic, or at least it was in a kind of a front in my sight that eventually in my life I will go through this. So it's been a very frustrating 2 years, very eye-opening, tired as an infectious disease doctor, and but I'm just glad that we are looking and seeing some light at the end of the tunnel here, finally. So what I want to do, I want to give you a little bit of a summary of what it has been for me personally. I'm a frontline physician, meaning the first two cases that we had here in Orange County, Kaiser, was a couple, a middle-aged couple, and I had the fortune to be on call that day when they showed up in our ER from another hospital, and so I had to go see them. So it was a bit of very uncertain as to how to manage that. Nurses were scared. I will tell you, I was scared, but I was concerned as to how much protection and how to get myself up and how to cover myself to go into the room. But we did. And through all the following months, that became sort of a daily routine for us, for the most doctors who were doing inpatient care. So the numbers started to just really snowball down in increase in the number of patients that were visiting the emergency department. Of course, anything normal in a hospital shut down. Surgeries were canceled. So it was we had to learn a lot of ways of how to work, how to do things in the hospital, in clinics. So it was a very stressful time for us in the hospital, for administrators, nurses, all the personnel that was helping. EVS, they were scared how to deal with this, the patients that they needed to go and clean up the rooms, and then the patients themselves, the human loss. Was very difficult to see a novel disease that now we were not allowing family members to come into the room and be with their loved ones when they were dying. It was hard. It was hard to see patients dying in the rooms alone, but we didn't know any better, and we didn't want to risk infecting other people, in the rooms. So day after day, we will just see, the numbers swelled up in terms of the initial patients that will come to the hospital floor. Then from there going to the ICU and spend 1, 2, 3 weeks sometimes on a ventilator, and a large number of them dying from this disease. So you had to get the mentality. We had to get the mentality that this was sort of a war medicine. You have to do things differently. You have to think about, nothing was normal. And that brought the whole group together as well. The doctors, the nurses, the respiratory therapists, we were working as groups in shifts, and it was intense. But, fortunately, we have learned a lot in the last 2 years. Now we're seeing this disease process a lot different than we did 2 years ago. We're not as scared as we were back then. We have some ways to treat this disease. We have vaccines to prevent this. We have some oral treatments available. So it is a significant progress in the last 2 years. And it's been very confusing to people. It's been complex and scary for the public. It's been grounds for politicization of certain beliefs in this. So there's been a lot to take with this pandemic. I graduated from Irvine 20-some years ago. I've been at Kaiser 21 years here as the chief of infectious disease for the last 6 years. And I never, of course, never have seen anything like this in my life, in terms of the number of patients that were dying, in our hospital. When you have 4 or 5 different patients dying every day, with the same disease process, you start getting very concerned, because I didn't know where this was going to end. Where are we really going into some difficult situation, which more than what we did, and you would see that what was happening in New York and Washington and some other big cities in the U.S. And so it was a very stressful time for us. And again, fortunately, we are significantly making some progress. So what is this pandemic, and what is the definition of pandemic versus an endemic situation versus an epidemic? So a pandemic is what we're living through. It's a very fast exponential growth of a disease process, typically an infection, that will go beyond the borders of a country. So it runs through borders, it runs through continents, and it spreads out widely. Think about, the Spanish flu in 1918. The whole world was involved, and so does COVID-19 in 2019. And an endemic situation is where you have a disease process that is consistently present, but is limited to a particular area. Think about malaria, like in Africa. Think about some other outbreaks of a disease process, Ebola, in certain countries of Africa that every so often will come on. So that's an endemic. An epidemic is a state that is an unexpected increase in the number of cases, maybe infection.
Became this federalized issue subject to where.
Sorry about that. Anna, are you able to?
Yes, I muted the participant, but yeah, Dr.
Thank you.
Salvador.
Yeah, please make sure that all the microphones are off. Thank you. Yes, please, Dr. Hernandez.
Thank you. So, if I was just to say the last couple of things about an epidemic situation is when you have an unexpected increase of cases, maybe infectious, might not be infectious. We've been talking about the epidemic of obesity in the U.S. For many years already. So that's also called, an epidemic. So an increased number of a disease process, but it tends to be in a geographical area. So the key here is expansion. Pandemic goes crazy, goes throughout borders. Epidemic tends to stay localized. So having, so that is the definition of the pandemic versus an epidemic. Going back to what have we learned, in the last 2 years about COVID-19? Well, a lot, because we didn't really know anything at the beginning. We knew very little. Mode of transmission. I remember having meetings with my colleagues as to how does this get transmitted. Is it droplet, or is it by touching somebody, or is it does it go into the air? And of course, treatment. We have nothing to treat this virus initially. So we have learned how to contain it. This is a very fundamental principle of scientific research that went into the process of trying to figure out how to best approach and manage this significant problem for humanity in general. And we have accomplished a lot. There's definitely significant accomplishments on not only the vaccine front, but also the acute phases of the disease, how to treat it, when to treat it, who we can just watch. So that has been an incredible progress in managing this disease through science. So just as one last point on here, maybe some of you follow this routinely, but the total number of cases in the United States as of now is roughly 80 million people have been infected, probably more than that, because some of them don't come to get tested, and so I'm sure it's more than that. And we are approaching the 1 million deaths that are being certified to have died from COVID or its complications. So perhaps more deaths than that are also can be calculated. So this is something that for a disease process to create this much death and infection is incredible. I mean, it's still, we are below what the Spanish flu in 1918 did. When it's calculated roughly 48 to 50 million people die at that point. But we certainly don't want to get anything close to those 50 million people dying. Dr. Giraldo, I believe you had some questions or you want to direct me a little bit?
Yeah. So you've covered quite a bit, a lot of ground, and I want to emphasize some of the very, very important you've made. And I take the advantage of saying hello. We have a lot of community health workers that have joined our session, and also members of the community. Hopefully, have Santa College students. We welcome you. And Dr. Hernandez, whom I introduced at the beginning, is a specialist in infectious diseases. For over 20 years, he's specialized in infectious diseases. So this has been part of your life, but like you said, even for yourself, you had not lived through a pandemic, and you have, there were also so many questions and so many unknowns. During these 2 years, there's so many words that we have learned that have become almost part of our vocabulary. We talk about transmission. We started to look at, how many new cases that were happening per day. We learn about virus and variants and coronaviruses. So it's been such a learning curve, like you were saying, so much learning for everyone in front of our eyes, in front of our streets. We know many of us had COVID ourselves. Many had people very close that had the disease. So it's been also in my own lifetime, an experience that I never thought I would go through, and I had only read in the books about a pandemic. But I do also want to mention, you've brought the numbers, 80 million. So I want you guys to think about 80 million. Think of the almost or 80% of the population of Mexico. A country like Mexico has over 100 million people, 115 approximately. 80 million people have had COVID in the United States. So, or maybe think about 2 Californians. If the state of California completely, everybody had COVID, and another California, 2 Californias, 80 million people, and close to 1 million people have lost their lives. So it's when you think about the magnitude, and that's what Dr. Hernandez also was saying, this disease that is spread through so many countries, all countries around the world, and so fast. So lots of there that you covered. I want to, before opening it up to our community members, we want to, I want to ask you, because you are a practicing physician, you see patients on a daily basis. What do you continue to see? Because one of the things we're talking about the first 2 years of the pandemic, and we're not out of the pandemic. So I wanted to ask, what do you still see? Also, is there anyone who can predict, or at this point, is there anyone who can say, when will this pandemic end? Those two, I think with those 2 questions, that will take us towards the half time.
Okay, sure. So where are we right now? What do I see in the hospital? You know, at Kaiser, in our system, because we're an integrated system, we have a way to monitor our patients on a daily basis. And there is a graph that is actually charting that gets updated every day. And it shows me for the last 2 months, where have we been, you know, in terms of percentages and the number of positive patients in the whole of Southern California, you know, not just the Orange County, but it's all Southern California. And just to give you an example, the first week of January 2022 of this year, the percentage of people tested that was coming back positive was 38%. So 38% of who we were testing was turning out positive. And the numbers were about 100,000 people a week, every 6 days. That was the peak for us. That's just for Kaiser. That doesn't mean that, you know, doesn't include everybody else, just for all Kaiser members that we were testing. So about 100,000 people in 6 days. The last record, just of the last 6 days, the percentage positive is 3%. And the total number of cases for Southern California is a little bit over 1,200. So 100,000 versus 1,200, 38% positive versus 3% positive. And I think we have a pretty good representation, you know, because we have a very large, you know, over 4 million people, members in Southern California. So that's a pretty good representation of what's going on probably in the state as a whole. So that's in the community. That's what we're seeing outside. In the hospital, when the peak of the pandemic in 2021, we had about 180 patients in our hospital with COVID. Right now we have 8. So the numbers have significantly decreased. However, that doesn't mean that this virus is still not up there and is present and is a problem. And why is that? Because, you know, you have, even though the numbers in the United States are significantly lower, there are patches in the US that the numbers are not actually, they're starting to go up again. Who hasn't heard about the D2 variant of Omicron, right? We are up to about 26% positive rate on this D2 variant now. So it doesn't seem to be as moving as fast as the Omicron did back in December, when from December 1st to December 30th, it went from being, you know, a handful of cases to be 86% of the total cases. So that was an incredible rapid expansion of the Omicron. The D2 is not doing that, okay? It is not here in the United States. But we are hearing from what's going on in Asia, Southeast Asia, in China and Hong Kong, and in Europe as well. Cases are going up. So how do one wrap itself around this? So the United States, you know, we numbers significantly lower. What is happening in those countries? Why is it going up? And that will be the dynamics of this virus. That's how this will continue to behave until, in my opinion, the virus has been with us for a couple of years, and we're going to corner this virus with our own immunities, with the vaccines. But that doesn't mean that we will, you know, this is the last we've seen of this virus in Southern California. It doesn't mean that we may not go back to have some restrictions again in Southern California, masking and etc. What I hope that continues to happen is that we continue to vaccinate patients. We continue to vaccinate the population, because just as rapidly as the virus has decreased, also the percentage of people getting the vaccine. So the numbers of people who are requesting vaccines has also dramatically has gone down. So and I get that we're all tired. You know, we don't want to hear this again. We want to, you know, to live a normal life. But the virus doesn't care. Doesn't care how we feel, how stressed we are, or how eager we are to go back to a normal life. Because the virus doesn't have that in mind. The virus is you know, give him an opportunity, he will reproduce, and that's all he does. So we can, can we go back to have those crazy numbers that we had 2 years ago or in the last 2 years? Probably not. California is one of the states with the highest rate of vaccinations. And I think that the more people will get vaccinated, including the booster vaccines, that does make a difference, that seems to have, a significant impact on my health, so that I won't end up in a hospital, in a ventilator and with complications. The more we do that, again, the more we're going to corner this virus to do things in other places too. And hopefully these other places also, they take their affairs in order and continue to circle, and to a point where we will narrow it down and more. Once the virus doesn't have many people, many hosts to vectors to move on from and infect one person and another, you had to break that in many different places. Then that's when we're going to start doing something significant. And I think we're seeing that, because just as the virus exponentially grows, we can actually bring it down too. And we're doing that. But again, this is a world pandemic. This is not a California pandemic. This is a world pandemic. And 2 years from now, we may get a different variant now from Chile or, Guatemala. Who knows? And we're back again into, are the vaccines going to be effective? Do we need to do things differently? So we are at that risk. So our guards can't be down. I mean, we sort of, marching along and making progress, but we can't just let it go yet. This isn't over.
Yeah, so Dr. Hernandez, and what I hear you say very, very clearly, very clear and loud, is vaccination. That what we have to fight this virus is vaccination. And you made some very important points. One, that the virus, I love that. The virus doesn't care that we are tired, exhausted, stressed. It just wants to survive. The virus, or this thing that, goes from a body to another body to another body, that's how it lives. And it's only through vaccination and having more people vaccinated is that we're able to cut that chain of life of the virus, in a sense. So vaccination continues to be so important. Booster, making sure if you love somebody, that person you should at all costs try to have that person vaccinated and boosted. You also mentioned that we really don't know, because since it's a world pandemic, that if there is a variant in another part of the world, we've seen how it travels. They travel. The borders, there are you just take a plane, you take a train, you take a bus, and the virus travels within us and other places, and it can come from any corner of the world. So we have to keep our guard up, and vaccination is one of the greatest shields we have. I was trying to take notes, and we're in a good moment now. I really like you presented the numbers. Having gone from 38 of positivity to 3%. So we're okay. We're in a good place, but maybe it is the place. It's a good place now. Go get boosted if you haven't done it, and not to have that sense that everything is over. So I think we're pretty soon want to be opening it up. I know already have some questions from the audience, and you might be able to ask them yourselves. But before that, because we're speaking about vaccinations, I know my colleague Anna will put on the screen, there are vaccination clinics coming up. So because we're at a good moment, it is the perfect moment for you, for a relative, for a loved one to be, accompany them, offer them, after that we'll go get ice cream. After that we'll go get some delicious taquitos someplace, healthy taquitos. And here are the places. Anna?
Thank you so much, Doctor. Yeah, we just want to highlight that tomorrow, Friday, we'll be at St. Anthony Claret in Anaheim, along with Northgate Market right here on Harbor and First and Santa Ana, and also Santiago Canyon College. Saturday, we're going to be at Golden West College and the SSA Central Regional Office. Come by and get your vaccine. Walk-ins are always accepted. I also want to highlight that actually next week, we will also have our vaccination clinic going on at Santa Ana College. It'll be from 11 a.m. to 6 on Friday, April 1st. We'll see you there. Thank you.
Great, thank you. So take note, if you forget, you can always call the Latino Health Center, the call center, and they will be able to remind you of where the vaccination clinics are. And if Anna, one of my colleagues, can type it on the chat for everyone to have. So now we're gonna open it for questions. Remember, all questions are good, because if you're thinking that question, other people might be thinking it. And when do you have the privilege to be chatting for over almost an hour with a infectious disease specialist? So we have had some questions that actually I'd like Rosie to go ahead and make some of your questions. Rosie?
Hi, doctor.
Hello.
Nice to see you again. I have a question about the viral evolution. Do you think that we can get a new variant with a different and more complicated clinical features than the one that we already had?
It's possible. It's possible because every time you allow this virus to replicate, it can make a mistake. That's how they get variants. In its replication phase, it can make a mistake and introduce a couple of genetic components that may change the structure of the virus. It may change it for the worse, which means that is detrimental to the virus. But by random, just by chance, it may make it better, meaning more suitable to infect the cells, more suitable to elude or to escape immunity or immune system or surveillance systems. So those events happen by randomness. The virus doesn't have an intention of saying, if I do this, if I change here, I will become more effective. They don't. But when you have millions and millions of events or billions of events, then randomness can create by selection these mutants that could be potentially more virulent or could escape or surveillance systems, or immune systems that allows the virus to be more lethal. So it is possible, but this again, it's randomness that has to cause this.
Thank you, Rosie. And I also asked my colleagues if there are any questions from the YouTube channels. In the meantime, Doctor, there is, understanding, like you were explaining to us, the numbers have come down dramatically. There is a new variant in the horizon, already here. But tell us a little bit about protection. So vaccination is number one, but other measures that we can be taking to take care of ourselves, of our families, because I think it is important. Remember, I said March 11th, the World Health Organization officially told us we are in a pandemic. There hasn't come a point where we've said, oh, the pandemic is over.
Right.
That hasn't happened. So we are still living in the times of the pandemic. What else can we continue to do? And even there are different regulations, but from your perspective, infectious disease specialty, also you mentioned you're the chief of emergencies. You still see people, what you see at the hospital. What do you tell your family? How do you protect yourself?
Yeah. So first and foremost, protect the elderly and protect the people who are susceptible to this, because they're the ones more likely to die. How do you protect them? Vaccinate them. So we've seen time and time again that young people get infected with the Omicron, particularly with the Omicron, and they get a sore throat for 2 days and they're fine. Nothing else happens. So that starts giving the sense of this is not as bad as the flu, not a big deal. But you have to remember there's still close to 700 people are dying every day here in the United States, and thousands throughout the world. So make an effort to protect your loved ones, the people who are in a home that are more susceptible, by vaccinating them. From them is, do we need to wear a mask? It is controversial. I mean, kids in school, there's a big controversial topic that I don't need to tell you guys. You've seen it every day on the news. There's people who are against, any type of masks or any distancing or any type of restrictions. They want them all to be thrown out. The bottom line is that we don't know what will that cause. I think that again, that as the more time we spend with the virus among ourselves, the better we will be. Why? Because we're creating more immunity. We're encroaching on the territory of the virus. We're putting them on a corner. But if, let's say, all of a sudden we stop vaccinating, which the number of vaccines is dramatically going down, and if we start going to football games and basketball games and concerts, and can we have a resurgence of this? Yes, we can. Is it going to be like 2 years ago when it was, having a significant mortality? Maybe not. But we will see the numbers go up again. So are we willing just to every year or every 2 years have a resurgence of this virus and creating a problem? And it will still kill people. It will still kill grandma that, she, even though she was immunized, but she's 80 years old and she may not have the best immune system, she will still die, from the virus. It will still kill you. So, those are things that the price that we're paying for being somewhat restricted, does it justify the fact that we're all tired already about this, just going out there and forgetting about not wearing a mask or distancing, etc. I think that we need to be cautious. And one analogy that I hear from, I don't know who, some guy from back east was saying, look, the issue about masks, people are so against the masks, because they don't think masks work. They work. They help us. They break the transmission of the virus. So why not use the mask as you use an umbrella? You don't walk around all day long with an umbrella if it's not raining. You use it when it rains. Okay, so we can use the mask when there is transmission, when there is the numbers that are going up. So in 2 months from now, 3 months from now, we see those numbers going up. To say, maybe it's time for everybody to use the mask again. Why? To stop the transmission. And then we probably put the mask away again, if the numbers go down. But we're building the plane we're flying the plane as we're trying to build it. So we're trying to have these sort of conversations as we go, and time will tell us, as to what is the best approach, But for now, we do the best we can, with what we have, with the information that we have.
Thank you. And I want to take this opportunity because our community health workers use a lot of analogies in their work, and they always try to explain, to break down information in terms that people in our communities will understand it. And I love the analogy of the umbrella. And also I'm going to take it a little further, because let's be real, we have, and in our culture and the way we speak very passionately, we speak and we also do, we droplets, little rain, we transmit. So the physical barrier of the mask does exactly that. It holds, it prevents from that, that rain pouring into other people, and that's how the transmission occurs. So I love it. Carry your umbrella, carry your mask, because think about in some climates where we might come from, some countries that we come from tropical countries, you all of a sudden you find yourself in a storm. And so carry that umbrella. And that coincides. We have a couple of, actually, we had related questions. I'll go through this one fast because you just addressed it. It is important. Is it important to carry a mask with us from here on out? Yes. Carry one in your purse, always in your car. Carry always, carry your mask because you might find yourself, one of the scariest parts I was all this time is, what if I get into an accident? What if someone that I love gets into an accident? And that's something I'm very conscientious of. You'll be interacting closely with people if something bad happens, but also when you go into a crowded place or, use common sense. Have you responded to this one. When we see that festivals and events for the summer are opening back up, is it safe to attend when fully vaccinated? I don't know if you want to add anything to that one.
Right. So if it's an outdoor event, it's probably a little more safe, but the risk is never going to go to zero right now. As a young person goes to a concert, what is my risk of, even if I get COVID, I probably nothing much is going to happen to me. But if grandma lives with me or my mom has diabetes, hypertension, obesity, and even though she has been vaccinated, but her immunity is winding down, I'm putting that person at risk if I give her the COVID. You see, if I bring it home. So those are the things that you guys got to think, or we all have to think about, not just myself, because I'm 18 years old or I'm 20 years old, I'm healthy. COVID is not going to do anything to me, which is probably true, right? Probably not 100%. But think about the other people around you, your coworkers. Maybe you will work with somebody who's got an immunodeficiency. And so those are the things that those are the questions that you should be asking ourselves. We should be asking ourselves. It's not just me, but it's what, if I give it to someone else, what's going to happen? Something could happen to that person.
And you almost slightly touched upon this one, but I mean, because you just mentioned people who are more vulnerable, like the people who are immunocompromised, but also people that work in high risk environments, probably meaning that you're very exposed to lots and lots of people all the time. Is it okay? I mean, is there any recommendations of getting tested every 2 weeks? Even if it's like the place might not be asking, but if as a precaution, the frequency of testing for someone who works in high risk environments.
Yeah, there are some places that have taken that approach of, particularly if someone is not immunized, that's what they're doing. They're testing them weekly in some places, sometimes even twice a week. But there's no real data to show us that is actually helping, that is actually something that needs to be done. In the surface, it looks like, yes, we're doing something good, right? We're checking you and if you have an infection. But I think that more than that is if you have symptoms. If you have any symptoms, get checked, stay home, don't bring it to work, don't bring it to your family or back and forth. Yeah.
Very good. And this is also for people in probably of all ages, but maybe younger people that, after this 2 years, there's a little bit of a sense of, oh my gosh, we can travel again, or we can go back to see our relatives that we haven't seen for over 2 years. Any additional precautions in addition to being boosted as people may travel again this summer?
I just hear an argument by the director of the airlines this morning that he was arguing that they're going to go to, I don't know, Congress or somewhere in the CDC, and they're going to argue that the airlines should not be requiring to wear masks anymore, just like every other business. Yeah. So his rationale was that, airplanes have a high filtering system. They are probably safer than going to a theater or going to a store without a mask. So I still think that if I'm going to travel in a plane, I'm going to wear my mask. I'm going to put a mask on. Why? Well, I don't want to take a chance. I don't want to take a risk. I mean, what's so bad about wearing a mask? If it's going to protect you from getting the virus. So what else can you do in addition to get your vaccines and boosted? Again, be aware of who's this person that you're going to be seeing, what's the situation you're going to get into. Is there somebody with a high risk condition? And if it is, get tested before if you're going to go visit somebody and you know that there is someone who could be more susceptible, get tested. Testing now is available, is widely available. So that I think is one of the extra steps that you can do to help and don't feel bad later on if you transmitted a virus to somebody who may have a hard time with it.
Thank you. And we are in the last stretch. And thank you, Cookies. I know it's a long day, but we're getting some really good questions. We also have from those folks watching on the Facebook Live, in addition to those that are directly connected to the Zoom. So one question that comes from the Facebook Live audience is, what are some of the common symptoms that have been identified with the new variant, the one you mentioned? Is there any particular that differs from the previous variants?
Yeah, not really. Anecdotally, there have been less symptomatic of respiratory symptoms, less cough, with the Omicron, because it has a tendency to affect less the parenchyma of the lungs. It stays more in your upper airways, around your nasopharyngeal area. So more of a nasal congestion, less of a cough, more of a sore throat. But, symptom-wise, they're very similar because the mechanism of action is identical in both viruses.
And we have a question from Roy that says, very interesting, is it useful at all? I haven't heard of this type of detection of identifying virus in the wastewater as an early sign in a city. So I mean, like from
Yes.
mental health.
Right. So the different one of the epidemiological tools that cities have been using is they actually can analyze the sewer water from the different cities, and that is one of the early signs that maybe there is an increase in the number of particles that have been going into the sewer system, and that is an early warning that maybe there is something brewing in those areas, and has been, quite successful at seeing that there is an increase in cases. So yes, sewer water is being used as an analysis.
Very fascinating. So for those of you also looking into, so this is environmental health, with infectious disease, very interesting indicator to help epidemiologists also in this early detection. One more question also from Roy. Should a person still keep their rapid test at home to have at hand the rapid tests? And maybe if there any advice, like how many should we keep for the next period? Any advice on that?
Yeah, no, I think that, I have a couple of them. My wife ordered them, that you could get 3 in a month. So we still have them. Are they useful? If I'm going to travel somewhere, or if I have any symptoms, it makes sense to get yourself tested. They are accurate. They are, and they're not difficult to utilize. Everybody kind of gets the hang of how to do it. So yeah, I think that they're very, very useful still. So yes, keep them. Don't throw them away.
Great. And so, Dr. Hernandez, we have a great question that I think will bring us towards the end in terms of the key messages that you also wanted to leave us with. And this is a community health worker, someone I think who also who has a lot of contact with people in the community, and still at this stage, like you and I talked about earlier, says for you, what is the most important reason of why some people don't want to get vaccinated, and is there advice as to how to try to convince them. This is from a community health worker experiencing some of what you yourself also experienced, and maybe some insights as to that. And after that, we'll start closing, and then Elia will be able to do your announcement. So please, Dr. Elia.
Sure. So real briefly, we are doing, initially the Hispanic Latino community was doing very poorly getting vaccinated. African Americans and Latinos, we were behind everybody else in getting our vaccinations. Right now, the last reading that I had is that I'll tell you who the highest group is, ethnic group, or it's Asian group. Is 96% are vaccinated with all vaccines. 83% of Hispanics are vaccinated with 2 vaccines. But where we are going down, or where we're not really very successful, is getting that 3rd shot, that booster. While 66% of Asians have had the booster vaccine, 3 vaccines, only 40% of Hispanics or Latinos have had the booster. So 40, we're half. And we know that that 3rd dose is very critical. It's extremely important to keep you from getting sick. That's what's gonna, with time, the immunity went down. We're not as protected. So having that 3rd dose is ultimate importance, and we're failing on that. So why is it? Why is it that people are not going to get the vaccine? I probably will have to spend an hour talking about the different myths, the different, we Latinos, we tend to believe more what the compadre or what the cousin or the friend or the neighbor says to me than what my doctor is telling me. A lot of times we believe what other people have been repeating from other people. Without doing a fact check or going beyond and trying to investigate by ourselves. So there's a lot of myths in the community, anywhere from sterility to Bill Gates following you with a vaccine, all this crazy stuff that, it's such a big distractors for people to concentrate on what's important. And we tend to follow those things somewhat, access, which you guys are doing the great job of, your efforts of making it accessible and to make it easy for people to get vaccinated. Nowadays, I think that anybody who wants and has the will to get vaccinated can get vaccinated, and relatively easy. Anybody can walk in and get a vaccine. You don't need appointments anymore in a lot of these places. We recommend that, but we will still take care of these places that walk in. So what's keeping this 40% of Latinos not getting the booster vaccine? Perception that it's not gonna happen to them. It's not gonna happen to me. The numbers are low. We're not hearing much of this anymore. But again, we will still see people dying. We will still see trickle of patients in the hospital, in the ICU, dying. Why? When if somebody could get this vaccine, you decrease 17 times your risk of dying by getting vaccinated, by getting your booster. 17 times, not twice, not 3 times, 17. So it is a dramatic decrease on your mortality, risk of mortality, by getting the appropriate vaccinations. I think that we've been trying to get the word out in our communities, get vaccinated, get vaccinated. But people are people, and we have our own minds, and we will do what we think is best for us. May not be what is best really for us, but we will act in that manner. And we can't force them, to get the vaccine. But forums like this, you guys have been up there, available and present, with hopefully an unbiased, way of trying to present our information to the patients, to the people, to the public, and then hopefully making the right decision. So that is one of the reasons that I think that, this pandemic is not going to end anytime soon, because we will have people resistant, not understanding, not knowing the importance of kind of following, the guidelines. I heard comments of people say, well, this is not going to stop. The pharmaceutical companies just will continue to just push another vaccine because it's money for them. It's not that. The pharmaceutical companies can make a lot more money doing other stuff too. This is not all about the money that these people are making. It's about protecting our health, because this is what the science is telling us. This is what the science is showing us, that we need to do this. If we need to have a fourth vaccine, a booster vaccine for a lot of people, which is sort of, is being discussed right now. If people are not getting the single booster, the third vaccine, they're not going to get a fourth one. A lot of people are not going to do it. So we will continue to see these high rates. Hispanic Latinos have been 1.5 times more likely to die of COVID than the general population. 1.5 more times. So we really, do ourselves a disfavor by propagating these things that we hear or see on the internet, or social media, that speak negatively to the vaccines, and then we repeat it ourselves. We're not doing anything good for anybody. If you guys want to have a discussion, call me. I'll talk to you guys. I have a frank discussion, because a lot of times it's fear. And if you don't have the knowledge and fear takes over, then it's very difficult for someone to get that out of your head. But there's people that are like you all guys, good intentions, that we do it because we are in the health profession and we're here to help.
Thank you, Dr. Hernandez, and definitely, and I know promotores are masterful at helping people make their own decisions, sharing stories that are true, and I'll tell you, I postponed my booster a little bit for with pretexts. I'm too busy. I don't want to be out of work. I don't want to miss my work 1 or 2 days. I'm too busy. I have had COVID in December. And so I said, okay, I have a little, I can wait a little bit. But I went, I made my appointment. I like you said, super easy, same day, 15 minutes of my day. And did my arm hurt? Yeah, my arm hurt. Did I get a headache? I did get a headache. But I am boosted. I feel safer. I feel also I protect my mom. If I travel back and I'm going to see my uncles and aunts, I am protected. I am protecting them. So the passing of the information that is, we don't know if it's right or incorrect. If we're in doubt that this information we just got in our WhatsApp or in Facebook is not right, let's not pass it on. It's like almost like, it's just like the virus. It's another type of virus. Is that infodemic that we've also experienced. It's passing bad information. So let's just stop that chain. Let's not pass on that information that we're not sure and we don't know where it comes from. So we're coming to an end. Thank you, Dr. Hernandez. It's been so delightful to hear from you. And I want to re-emphasize 21 years dealing with infectious diseases. So we have this wealth of information and this great opportunity to ask our questions, receive almost like a one-on-one. I learned so much tonight too, and the great questions from the audience. So I want to thank you. And Eli, I pass it on to you. I spent 1 more minute. Sorry for your announcement. Thank you, Dr. Hernandez.
You're welcome. Thank you. Good night.
Thank you.
Thank you, Doctor.
You have a great
Thank you.
Quickly, we just want to announce that starting next week, the name for these sessions will change. It's not going to be Pregúntale al Doctor. It's going to change to Platicando con Promotores. So we will see you next week on March 31st for the session Platicando con Promotores. En español, rapidito, nada más les queremos dejar saber que para la siguiente sesión, ya no va a ser Pregúntale al Doctor, va a ser Platicando con Promotores, así que los esperamos para la semana que viene con nuestra sesión de Platicando con Promotores. Gracias.
Thank you. And that brings us to our end of the event. And again, Dr. Hernandez from Pacto Permanente, thank you so much. And all the audience and promotores and Ana College, go get vaccinated, boosted, let's protect ourselves. Thank you. Bye-bye.